Yes, we can.
Fine. All right. Thank you so much, Amal. I apologize to all the participants for the delay. This is one of those technical things that happens. So, Ms. Amal, with your permission, may I continue? Because we've lost
Yeah,
some
yes,
time.
please, doctor. We're
Yeah.
very eager to
All right.
hear.
Yeah. To all our dear parents, professionals who are here today, uh, I'm going to share some light on a topic that everybody's heard of, but there is so much confusion around it. Does it work? Does it not work? What is, I mean, there are so many issues, and we're going to look at all of them in a very simplified fashion. So I'm basically a neurosurgeon and have my own hospital. That's the Neurogen Brain and Spine Institute. I'm also professor at the medical college. So what I'm going to share with you is what we call a holistic approach. All right. And what is new? What I want to share with you is that we need to combine all of this. People have a misconception that there is some one silver bullet that will take care of autism, that stem cells by itself will make the autism disappear, and that's not correct. What is required is a holistic approach. So the advances are that first, we now have newer brain imaging, and I'll very briefly share with you. There are scans that can be done in the brain be able to go about their day-to-day activities without understanding why. But when you actually see on the scan, there is this part of the brain that's not working. Now you begin to understand why a child is the way he is. Then conventional rehabilitation plays a very important part. It is a myth that once you do stem cells, there is no need for rehabilitation. In fact, the opposite is true. What we have found is that after stem cells, you need more vigorous, you need more aggressive, you need more focused, you need more targeted rehabilitation. If the brain is like a computer's got hardware and a computer's got software. Please remember and listen to me very carefully. Stem cell only repairs the defective hardware. Stem cell does not and cannot put software. The software comes from rehabilitation only. So the importance of rehabilitation is much, much more with stem cells, especially after stem cells. Then there are some special kinds of rehab. I mean, in many places they are not special, but in some places they aren't available. We look at that. And then there's cellular therapy, which is my area of expertise. I will talk about it. And then we also have some oxygen-based integrative therapies that we are now combining. So let's look at some advanced brain imaging. So this is a scan of the brain, and what you see green is normal. If I did, maybe your and my PET CT scan, everything would appear green. But here, what you see blue is hypermetabolic brain. That's brain that's not working, and it's a live brain. It's not dead brain. It's living brain, but it's functioning less. And because it's not working, the parts of the activities that are controlled by these areas, they actually don't happen. So when you see the scan, and you don't have to be a doctor to see this, it's a very clear distinction. There is blue, which is damaged, and there's green, that's normal. Anybody seeing it will easily identify which parts of the brain. Also, the severity. Is the damage mild? Is it moderate? Is it severe? So this is what I call an eye opener. When parents see it for the first time, actually, they come to terms with what is happening with their children. And this work of ours is actually published in a very prestigious journal, the World Journal of Nuclear Medicine, where we've actually shown the baseline, age-related developmental metabolic changes. So what I'm telling you, all our work is published in peer-reviewed journals. Then there is, of course, neurorehabilitation. Now, I won't go into details because you all are familiar. We do require behavioral therapy and speech therapy and occupational therapy and physiotherapy and art-based therapy. These almost all of you are already doing. But what is happening is we are doing all this on brain that's damaged. And that's why we are not getting the results that we should get. Okay. Now, the same rehabilitation, when it is done on a repaired brain, you're going to get much better results. And from what our therapists tell us, you get 3x results. Like if you do a particular therapy before stem cell and get an X result after stem cell, the same therapy gives you a 3-time greater result. So very often I say the purpose of stem cells is to enhance the results of our rehabilitation therapists. And then, of course, I said there are some newer, we call them special, but now they are routine, sensory integration, which we believe plays a very important part. And aquatic therapy, we have been finding of late that aquatic therapy plays an exceedingly important part, in the rehabilitation process. Then there are some additional treatments like diet that you're all aware of, ketogenic diet, casein-free, gluten-free, etc. There is supplementation. Very often our children have deficiency of vitamins. We are identifying vitamin D as a big, deficiency. Almost all our kids are coming with shortage of vitamin D. There is gut cleansing that occurs because there is a gut-brain relationship. So all these treatments have to be done together. Now we'll come to the main talk of today, which is on stem cell therapy. So these are the questions that I believe we were supposed to answer. What are the different types of stem cells and the different types of administration of stem cells? So I say cell therapy is something which shifts us from a state of hopelessness to one of hope. All these years, and I've been in this field 30 years. I remember the first 10, 15 years, we were so hopeless. There was nothing that we could do. But today we have a tool, we have a technology that's safe, that's simple, that can actually correct the damage in the brain. So the word stem comes from the stem of a tree or a plant. And just like from the stem, you have branches and leaves and flowers and fruits. There are some cells in the body from which all the other cells can arise. There are cells from which you can get brain cells, muscle cells, blood cells. So these cells from which any other cell in the body can arise, these are called stem cells. How do they work? So the first property of stem cells is that they multiply. So if you have a single stem cell, they multiply and you can make many stem cells from it. Then this is the most exciting property, the ability to convert. So if you have a single stem cell, you can make this into a brain cell, into a heart cell, into a muscle cell or a blood cell, which means the same stem cell, depending on where you put it, will become that. If you take the stem cell and put it in the liver, it becomes a liver cell. You put it in the brain, it becomes a brain cell. So they have the amazing ability to convert into whichever cell type that you want. They also release certain positive growth factors. These are called paracrine effect. And, these are very, very strong chemicals which actually help in the healing process. And they're called growth factors. They also improve the blood supply. So if there's decreased blood supply first, where the stem cells go, they attract fresh blood. And when fresh blood comes, there is also healing that happens with that. Now, the question was, what are the different types of cells? So broadly speaking, there are two types. Cells which are autologous. That means you take it from the child and put it back in the child. That means cells from the same patient or same child. And then there's allogenic, which is a donor. The cells are from somebody else and they are put into a child. So broadly, these are the two different types. The other division, which is important to understand, is you can have cells from the embryo. So the embryo is, when life starts, the father's sperm and the mother's egg comes together. On the 5th day of life, it is a grape-like bundle of cells. So all of us, on our 4th or 5th day of life, were a grape-like bundle of cells in our mother's womb. And this was a bundle of embryonic stem cells. So all of us actually started life on our 4th day as a bundle of stem cells. And from these, the whole human body was formed. So if these are removed and you can grow them in the laboratory and make stem cells out of it, but these are dangerous. These are cells that have complications. They can become tumors. There are ethical issues. There are religious issues. So we do not use embryonic stem cells. We do not do anything that is close to not only just embryonic, but we do not take cells from anybody else at all. You can also get stem cells from the umbilical cord. So the umbilical cord is the cord that connects the mother and baby at birth. This is very rich with stem cells. And nowadays, at birth, these are being saved. And if they have been saved, there's the potential for use in them. But the majority of us have not saved it. So there are some people who collect these, umbilical cord from different maternity homes. They pool all this blood together. They have cord blood banks, and then they manufacture umbilical cord stem cells, and they are sold. Now, these stem cells are from somebody else. I mean, they are donated cells from hundreds of nursing homes. And the difference between umbilical cord and what we use is that these umbilical cord cells, first, they have to be preserved. They are preserved at sub -0 temperatures. And then to be used, they are thawed and used. So they are cells that belong to somebody else. They are preserved, so they have a preservative. And they have been cooled at sub-zero temperatures and then thawed. So it's a very artificial thing that is happening there. And you cannot inject this directly into the spinal fluid because the preservative for umbilical cord stem cells, something called DMSO, is toxic to the brain. That is why as Ms. Awal was just telling you before I started, when you inject this IV, it goes first to the heart, then to the lungs, and about 50% of it gets trapped in the lungs. And only a small percentage of it actually gets to the brain. And the brain again has a protection system called the blood-brain barrier, which doesn't permit all the cells to come. So that is the broad difference between umbilical cord cells and the cells that we use. So we do not use umbilical cord cells at all because one, they are from somebody else, two, they are preserved, they are preservative, and three, you cannot inject them into the fluid like I will show you what we do. Now, the third type of stem cell is adult stem cell. This is autologous. This is taken from our own bone. So our bone, all our bones in our body, at the center of the bone, there is a liquid called bone marrow. We all have heard of bone marrow. This is the place where our body manufactures blood. So if you put a needle into the bone and take out, and I'll show you a small video how we do it, then you can take out the bone marrow, and this has got millions of stem cells. What are these stem cells doing there? They are all going to become blood. But if we take them out, separate the stem cells and put them, wherever we put them, they will become that. So in the bone marrow, they would have become blood. But when we take them out, if I put them in the brain, they will become brain. If I put them in the muscle, they will become muscle. So we prefer to use these because they are from the child and they are very safe. And there is a recent development called induced pluripotent stem cell, where the outside is autologous, the inside is embryonic, but this is only in the research stage. This has not been used in humans so far. So we work with adult stem cells because they are 100% safe. They've been actually, adult stem cells have been used for the last 70 years to treat various blood disorders. We are using it for neurological disorders only in the last 15 or 20 years. They never become tumors. They don't get rejected because they are our own cells. They're easily obtainable. Just a needle. Put a needle in the bone and you get it. No surgery, no cutting, no stitching. And there are no ethical issues. There are no, because you're taking your own body's good healthy cells, putting it back. There are no issues about it. Now, how do you administer them? So what we prefer to do is, you can see this picture, we put a needle into the lower part of the spine and inject it into the spinal fluid, because the spinal fluid then carries it all the way to the brain. We just inject it here and within minutes it reaches the brain. So it's a very simple way. We are directly getting into the brain fluid. And once it's here, it cannot leave it. Unlike umbilical cord cells, which you inject intravenously, like I said, it goes to the heart, then from the heart to the lungs, from the lungs it comes back, and then it goes to the brain. So we prefer this, but the other way is umbilical cord cells, which are injected intravenously. You can inject intramuscularly, like we in patients of muscular dystrophy, where the problem is in the muscles, we inject it intramuscularly. You can inject it into the arteries, you can inject it into the nose directly, you can inject it directly into the brain. So there are different ways in which we can inject it. I've used many of these in various research projects, but what I find is that the intrathecal is really the best. Simple, one little needle prick and directly accessing the brain. So basically, what is stem cell therapy? We are using healthy cells. We are using good cells, our own good cells from the bone marrow, to replace the damaged cells. So here's a scan which is showing the blue damage in the brain. If you give stem cells, the damage gets resolved. So I'd like to, this picture is, I just like to show it because it highlights a point. Now, on the left-hand side, you can see this bone. This is broken. You can see this is the leg bone, and we have two bones in our leg, and they are both fractured. And I ask you a fundamental question. If we had a fracture of the leg, would we do physiotherapy on this broken bone? Would any of us do therapy on this bone? Would any of us walk on a broken bone? Would any of us try to run on a broken bone? We would not, right? What would we do? We would go to an orthopedic surgeon. He would put plates and screws and fix all the broken parts. And we would do physiotherapy on a repaired bone, on a fixed bone. But for our special needs kids, we are doing exactly the opposite. Here's a scan of a child, with autism. The blue is the damaged part. We are doing rehabilitation on a damaged brain. We are expecting the brain to do things that it is incapable of. That brain is non-functional. And we keep pushing the brain to do things that it just cannot do. All right. And then we don't get the results that we want. And then children get, imagine if you had a fractured bone and I forced you to walk, you would get irritated, you would get bugged, the bone would not heal properly. there would be all, apart from the pain, there would be all behavioral issues. So, but this is what we are doing. Now, what if we repaired the brain? You can see this. This is the brain that's come back. And what if we did the same rehab on a repaired brain? Would we or would we not get better results? Okay. So that's the point I'm trying to make. We need to repair the damaged brain. And there is only one way to repair it, and that is through cellular therapy. So what's the scientific base? Well, the highest recognition in the field of medicine is the Nobel Prize, and 3 times in a 15-year period, 1990, 2007, and 2012, the Nobel Prize, and this Nobel Prize is given to the highest accomplishments in all fields of medicine. And stem cell therapy has got the award 3 times. In fact, what we use, stem cells in bone marrow, got the Nobel Prize in 1990. So as long back as that. So that's the scientific base. And now let's quickly look at how the treatment is done. So I'm talking of now autologous. I'm not talking of umbilical cord because that is just an injection. I'm not talking of embryonic. I'm talking of bone marrow. So there are 3 steps. We put a needle, this is the pelvic bone. That's the bone just above the hip bone. We put a needle into that and we pull out the bone marrow. I'll show you a short video of that. The bone marrow is taken to the laboratory where the stem cells are separated, and then through a very thin needle, we inject it into the spinal fluid, and the spinal fluid takes it up. So in the whole process, there are only 2 needle pricks. With one needle we take out, and with the other needle we put in. That's the beauty of the treatment. 2 needle pricks. There is not even a cut, not even a stitch, not even a suture. And what are we putting in the child? The child's own healthy cells, taken from an area where there is abundance and put in an area where there is scarcity. So let's just look at this video. You can see this. See, that's the bone marrow that's coming out. The child is sleeping, and we take it to the laboratory. We run it through various machines. There's very sophisticated equipment that tells us the number of cells. And then through a very thin needle, we inject it into the lower spine. I'll just play this video again because this is very important just to show you how simple the procedure is. The child is sleeping, and we are just, how you take blood out for blood connection, we take out from the bone. We do the cell separation, and then with this very thin needle, we inject it into the spine fluid. These are the stem cells, all right? So that's how it is done. And again, just to show you still pictures, bone marrow aspiration, it goes to the laboratory, and then we inject it. So which diagnosis can be helped by stem cell therapy? These are the questions that were sent to us, so I'm answering them. In children, the pediatric neurodevelopmental disorders, we can treat kids on the autism spectrum. We can treat children with cerebral palsy and a hypoxic ischemic injury to the brain. We have treated intellectual disability. In addition to this, we have treated several patients of Down syndrome. We've had children who've had hypoxic injury, like, they've drowned in the water and their brain has been damaged, etc. We've treated those as well. There are certain life-threatening neuromuscular disorders like muscular dystrophy. One of them is Duchenne muscular dystrophy, where all the boys die in their early 20s. And we've been able to save more than 3,000 lives because our kids are now living way beyond that age. There's a disease called motor neuron disease in adults, which also there is a 90% death rate. And we've been able to save several lives. Very often in adults, there's a paralysis which may occur because of either injury to the spine or to the head or a brain stroke. And it was earlier believed that once you're paralyzed, there's nothing that can be done about it. But we've reversed in a couple of thousand patients damage which is there from paralysis. So we all know autism. I won't go too much into detail. It was just first described in 1943. Diagnosed in the first 3 years of life. We refer to it as a spectrum disorder, and boys have it 4 times more than girls. But this is something which I'd like to highlight. You see, in 2004, the incidence of autism was 1 in 166 kids. Just look at this graph and see how the incidence is increasing. In 2020, it was 1 in 54. In 2022, it is 1 in 44. These are not my figures. These are figures from the US CDC, the Center for Disease Control. Now, at this rate, okay, if it keeps going, in a couple of decades' time, or even less than that, you're going to have more children having autism than not having autism. So, governments, policymakers, people in public life are not understanding what we are doing to our society. These are not my figures. These are the US CDC figures which show there is no disease, there is no illness which has had such a dramatic increase. in recent times. That's 1% of the world's population today. It's 70 million people on the spectrum. It's huge, and nobody talks about it. Nobody recognizes it. There aren't enough rehabilitation centers all over the world. There isn't enough, support and protection, except of course in the Arab Emirates and in Dubai, because you have this amazing card of persons of determination. There are a lot of rights that kids with special needs have. So I think Dubai is showing the world the way ahead in how these kids need to be looked after. There are some amazing rehabilitation centers. Some of them I visited myself with the state-of-the-art equipment, but it's not enough. The number of children who need this is much, much more than the supply that's available. We all know the problems primarily of communication, social interaction, repetitive behavior. And this is what I showed earlier also. What we have identified is there is a definite part of the brain in what is called the medial temporal areas and the smaller brain that's referred to as the cerebellum, that in almost all more than 3,000 cases that we have done these scans, and every child has this damage. And we've done this in some normal children, and no normal child has this blue. So the damage is quite severe. And this is just our data that when we treat patients with cell therapy before and after, we do some scores. Like this is a CGI score and ISA score. And then when we take an average before and after, we see a significant difference. And then we have to do what is called a statistical calculation, and we see that it is significant. In different symptoms like social relationship, emotion, speech, behavior, etc. Again, if you take the median before and the median afterwards, you see in all parameters there is a significant improvement. But this is the most amazing. So these are PET CT scans, and what you see here blue is the damage before. This particular type of scan is done on a Siemens machine. You'll see some other pictures that is done on a General Electric machine. There are two big companies that make PET scans, so the images look a little different. Now above you can see that's the damage before, and now 6 months later, the pictures below, you see the damage is gone, right? So there's damage before and there's damage gone, and I'm just showing you one or two, but we have about 3,000 pictures like this, damage before and gone afterwards. So you can see again here, this is the blue damage, and you can see after stem cells in 6 months it's gone, and you can see the extensive damage, and after 6 months it's gone. And of course, then there was this debate: does this damage come back? So in a few patients, we did this year after year, and we found that the improvement is persistent. You can see this and then this and then this. It's becoming, over the years, it becomes less and less and less. So our work has published. The world's first scientific paper on stem cell therapy in autism is actually published by us. The second papers come from China, the third from Italy, and the fourth and fifth papers have come from the United States, from Duke University. We have 16 other scientific papers on this. There are several international textbooks which have published chapters, and when they write so this is a book on recent advances in autism. Not only have they introduced a chapter, stem cell therapy, but they invited us to write this chapter. Then very briefly, I'll just run through cerebral palsy. In cerebral palsy, of course, the damage is in the brain, but you see the effects more in the body. So you could have different types where it's one side that is hemiplegic or diplegic, or all the forearms and limbs, and there are different descriptions. So it all depends on the damage, which part of the brain is damaged, and depending on which part of the brain is damaged, you can have a dystonic or a ataxic cerebral palsy. And as you can see, the damage in CP is far more severe. You remember the pictures in autism I showed you, they were lighter blue. Here you can see it's dark, it's black, it's more severe damage. So the damage in cerebral palsy is much more severe than the damage in autism. Now, there are a whole lot of drugs that we can give, for seizures and for spasticity, etc. There are certain surgeries that we can do, both neurosurgical and orthopedic. But all this doesn't take care of the primary problem. The child is still dependent and very often wheelchair bound. So these are our results. In about 600 patients, you can see 20% had a significant improvement, 41 moderate, 30% mild, and 9% did not improve. So that's about almost a 90% success rate. And here you can see the scan. This is on the left side, you can see the damage before, and the same child on the right, you can see after stem cell, the damage is gone. Here again, you can see the extensive damage above, and after 6 months, the scan below, you can see the damage is gone. Again, this European textbook on cerebral palsy, and they introduced a chapter, stem cell therapy for cerebral palsy, and they invited us to write this chapter. We have several papers. This is one of our earlier papers, and then we have 15 other scientific papers. In intellectual disability, also cell therapy helps. Here, the damage you can see is a little lighter. It's not as severe as cerebral palsy. It's a little more diffuse than autism. And these are our results again. You can see there's a 84% results in intellectual disability. The cognition, memory, problem solving, toilet training, social inhibition, all these things are improved. And again, the world's first paper on stem cell therapy in intellectual disability has been written by us. And here's a scan. You can see the damage above, and you can see below the damage is gone. You can see the damage above, and you can see the damage is gone. And this is my last topic. Because of want of time, I'm rushing through. There's a condition, muscular dystrophy, where the muscles slowly get damaged over a period of time. And here you can see at 5 years, you can see the muscles are normal. And then if you keep going at different years, you can see that the gray goes away, it becomes white, it gets replaced by fat. And by 15 to 16 years, there is almost no muscle left. So here you can see a 5-year child with normal muscle and a child of muscular dystrophy at 21 with almost no muscle. This is the point at which most of these children, die. They don't survive. And these are our results. As you can see, we have an 85% success rate with this. And we did a comparative study. Children who took stem cell therapy, we showed that they stabilized, and children who did not take, they continued to deteriorate like this. So this is what is called a comparative study, where you compare treated versus untreated patients. And there's a big difference between the two. And when we do MRIs, here's an MRI which is all white, and you can see after cell therapy, muscle has started coming back, which is gray. This is an EMG, which shows muscle contraction, very weak before stem cells, and after stem cells below, you can see it's become more solid. And this is an international textbook on muscular dystrophy by Avid Science. And again, they introduced a chapter, Stem Cell Therapy in Muscular Dystrophy, and they invited us to write this chapter. We have 18 other papers on this. That was cell therapy, but I'd like to add something else that we've been introduced over the last, very briefly, just a couple of minutes, we've added what is called integrative therapies. I'll very briefly run through just 2 minutes. These are oxygen-based therapies. You all are familiar with hyperbaric oxygen. That's a chamber, and in which a child can go, with the parent. And the principle of hyperbaric, I'd like to explain. See, we are now breathing oxygen at 1 atmosphere pressure, and our blood has got red blood cells, white blood cells, and a liquid called plasma. So when we breathe at 1 atmosphere, only the red blood cells carry oxygen because the hemoglobin is in the RBC. But when you give it under pressure, it goes into the liquid. So the whole blood is flushed with oxygen. This goes into the deepest parts of the brain, and it's very, very useful. There are a lot of benefits of hyperbaric oxygen. I'll just run through this fast because we're running out of time. We also use something called ozone therapy. Oxygen is O2, ozone is O3. It's superactivated oxygen, and it's got several beneficial effects, which kills sulfur-loving microbes, reduces infection, blood clots, and is an antioxidant. So it can be, and then we do gut cleansing and acupressure. These are various things. So my conclusion is that adult stem cell therapy, which is what we do, is a safe and effective treatment option. I don't know, there was a slide. Oh, sorry, this got reversed up. So adverse events, because this is actually the most important slide. Their adverse events are divided into two: major adverse events and minor adverse events. What's the difference? A major adverse event is something which is permanent, which has a lasting effect, which is irreversible, and which worsens the child's condition as compared to before. That means there are things that a child can do which the child now cannot do after the treatment. So in 12,000 patients, we've not had any major adverse event. We've had no child who has worsened neurologically as compared to before. We have a zero infection rate, so no child has got infected. But there are some minor adverse events, of which the most significant one is epilepsy. So we now have seen that 3% of our children who have existing epilepsy, their epilepsy can worsen after the stem cell therapy. And we've published this in a paper. We've published a separate paper on our adverse events. So now 3% may be a small figure, but for the parents for whom this happens, it is quite upsetting. Because there was a child, who may have had seizures earlier, and suddenly after the treatment is starting to have epilepsy. You have to go to your local doctors, you have to step up the medications. So this is an adverse event that we have to accept. It is there, it is documented, we are just honest about it, and we've published it. It used to be 6% earlier, but now what we've learned that if you add an anticonvulsant, we are able to bring it down to 3%. So if it happens in the first 6 months. By and large, we've not noticed it to happen after that. So although the reason we call it minor is because it is reversible. It's not because you give anticonvulsant medications and it stops. Also, it does not cause any major deterioration or regression in the kids, right? So, but it is a serious consequence, and we have to be aware of it. Now, 10% of our children get what is called a spinal headache, but this happens during your stay in the hospital. So you are in the hospital for a week, and we've noticed that 10% of our kids get this headache. Now, this headache is not because of stem cells. This is because of the spinal puncture. And it's a very peculiar headache because it goes away on lying down. It only comes up when the child sits. And so the child will tend to be sleeping for 2 days. It can be associated with 1 or 2 vomits. For the parents, again, it's very distressing because their child who was otherwise playing around suddenly chooses to lie down, and they can't understand why the child is lying down. It lasts for 48 hours. If it starts, it lasts for 48 hours, but it never happens when you go back home. It happens in the period immediately after the cell therapy. A couple of kids may have some nausea, some vomiting, they may have some local pain at the side, but that's not very severe. So these are the adverse events of which epilepsy or seizures is the only one that one has to remember and make note of, and the spinal headache, of course. And my conclusion is that adult stem cell therapy is safe and effective. If you notice, I put safe before effective. For autism, cerebral palsy, and for several other conditions for which there are no other treatments. I don't know if we have time, but we were asked to, and then this was the last question we were asked, what to expect and what should be done. So the expectation is what we have to tell you is that the improvements after stem cells are progressive. So it's a very slow thing. For the first 3 months, you really don't see much. You start seeing improvements after 3 months. And from 3 months to 6 months, they are very good improvements. Now, in those children where the damage is mild, which is, then they just need a single treatment. In those kids where the damage is moderate, they need 2 treatments. Those where it is severe, they may need up to 3 treatments. So how do we know this? We know this on the PET scan. So when you come to us and do the PET scan, we will tell you, is the damage mild, moderate, or severe? And then we can predict how many treatments. Now, the improvements are progressive and slow, and starting from the treatment, they can go on for up to 2 to 3 years. So it's very progressive. Now, what are the criteria that decide the thing? First, the younger the child, the better the treatment. So we have found that those kids who are below 5, the majority of them actually do very, very well. The next best is between 5 and puberty. They also do well, not as well as the younger kids, but they do well. Now, post-puberty, unfortunately, the results they drop significantly. These kids do improve, but we can't get them close to being normal and independent like what we want. There are a lot of improvements, but we can't get them off the spectrum. We can't get them to be completely independent. We can't get them to be what we call neurotypical. So the earlier we treat, the better the results are. So it's progressive because stem cells is not a drug. When you take a drug, you have a headache, you take an aspirin, your headache goes away. There's a beginning and an end to a medicine. However, stem cells are organic. You put seeds in the soil and how they grow. So that is how the improvement happens. And what should be done is you have to do neurorehabilitation. Without rehabilitation, you will not see the best improvements after stem cells. So with that, I'd like to thank you for your attention. And there were some success stories, but I don't know if we have time for it.
We have so many questions, Doctor. Thank you very much for your time and for the very nice presentation. But we have questions that we'd like to answer the parents, please.
Absolutely.
So my kid is 4th stage, puberty. Does this mean that he will not benefit from stem cells?
What do I do? No, he will benefit from stem cells, but the benefits would be not as much as if we would have done it before puberty, and not as much as if the child was less than 5 years. So the basic parameter is the younger the child, the better results we get. The older the child, we have lesser results. It's not that we don't get results. But my answer to this question is See, we can't go back in time. We can't make our child younger than what he is. However, we can see that there is no further delay. So if, let's say, today our child is 11 years old, yes, it's true. If we had done the treatment at 8, we would have done better.
Yes.
But can we make our child 8? No. But what we can ensure is that 11 doesn't become 13. That is
Yes.
in our hand. So we have to concentrate on what we do, is not to delay the treatment. So that's the answer to your question.
There's also a question about epilepsy. If the child does not have epilepsy to start with, can he get epilepsy afterwards?
No. So we have seen that if the child doesn't have epilepsy and if the EEG is abnormal, so you all are aware of a test that we do called EEG. So if the EEG is normal and if the child has not had epilepsy, he will not get epilepsy. But if the child has ever had epilepsy in the past or the EEG is abnormal, what does that mean? Sometimes children, there are some children who have absent seizures or they have seizures that the parents may not have noticed or seizures that
Yes.
happen in sleep. So the parent has not seen the seizure, but the EEG picks it up. Okay, then the 3% possibility remains.
Yes. What's the duration between rounds?
So we keep a minimum 6-month duration. That is the protocol that has been approved by our committee. We have something called Institutional Ethics Committee that monitor our work. So
Yes.
6 months is now. What is the rationale for 6 months? One is the safety issue because we are taking out the bone marrow. Second is that at 6 months we normally have peak improvement. So if you do it earlier than that, maybe you are doing it if it's not required. For example, a child might become normal at 6 months and you do a repeat stem cell at 3, then you're doing it when it is not required.
Yes.
So 6 months is peak improvement. If there haven't been full improvements by 6, then you can do it. That's our protocol.
Also for CP patients, when the child should receive stem cell therapy to have good outcome. I think Dr. Alec answered this for
The
everyone.
earlier, the better. Yeah.
What is the best age to start for patients with muscular dystrophy?
Once again, the earlier, the better. The
Okay.
children do earlier, they are now walking. We have children who are now, walking at 16, 20 years, where it is unheard of for a muscular dystrophy child to be walking at that age. So the answer to all these questions is the earlier, the better.
The better. Specific inclusion criteria.
So inclusion criteria, one is, a very definitive clinical diagnosis. And secondly, when it comes to neurodevelopmental conditions like autism and CP, the PET scan has to show damage. In other words, we are not allowed to treat patients whose PET scan is normal. So if you come to us now, of course, we've never seen that a child has symptoms of autism, but the PET is normal. But should the PET scan be normal, then our protocol doesn't permit us to treat because we can only repair a damaged brain. We cannot put stem cells into a brain that's not damaged.
So that's also for genetic disorders. Only if you have brain malformations, you would answer.
If there's nothing wrong with the brain, we cannot put stem cells. It's not a choice I have. It's the approved protocol.
Okay.
Because we have some government registered committees. We have a equivalent of FDA registered institutional ethics committee that monitors our work. So they've laid down very strict criteria. We have to follow them.
Okay. Can stem cell therapy be done in UAE? Dr. Alok, would you kindly join the team in UAE and administer stem cell therapy?
I'd love to, and we are in the process of initiating this with the government of the UAE. At present, there is a restriction because there is no law. I did approach the people. I spoke to people in the ministry, and at this point, there is no law that definitively permits it. So we are in the process of trying to work to something. We have
Hopefully.
a couple of offers from a couple of hospitals, very big hospitals. And if all goes well, inshallah, we will be in the UAE in some time.
Inshallah. Any research of stem cell therapy can be used for osteogenesis imperfecta?
Yeah, it can be. There are some people doing it, but we aren't doing it because, that falls outside. So we are basically treating
the brain,
neurological and neuromuscular disorders. This becomes orthopedic. But there are people, there are several countries in the world where this is being treated with stem cells, but we don't do it.
Okay. Can stem cell therapy be used for leukemia?
It can be. In fact, it's been used for leukemia for last many years, much before we've been doing this, for about 40 years before. There, what of course the stem cells used are, donor stem cells. You take stem cells from somebody else. And yes, for leukemia, stem cells have a very important role to play. But we don't do it. We do only neurological.
Why it should not be done before 5 years for children on the autism spectrum? Many cases are diagnosed at the age of 2 to 3.
No, we can do it. I never said we should not do it before 5. In fact, I said we should do it before 5.
Yeah,
I
the
said
best age is before 5.
that the best results come in children before 5. So those children who come to us when they are 2, 3 years, well, in a very short time, they're completely off the spectrum. They're going to normal schools, they're excelling in their studies. I mean, when they follow up, we find it difficult to actually believe that this child could not speak, this child wasn't going to school. We have to dig out the old records and tell ourselves that, this child actually
Yes.
can speak. The improvements are very dramatic
Yeah.
in the 2 or 3 years. So in fact, 2, 3-year-old children, it should be done.
How much is the average cost? You can reach out to the website of Neurogen and communicate about the cost. My 3-year-old is suffering from epilepsy and brain damage 40%. Can stem cell therapy be useful for him?
Yeah, so the stem cell therapy will help in other things. It will help in, if suppose there is spasticity, it will improve it. It will help the child to walk. It will help in the head holding. It will help in the sitting. But it will not reduce the epilepsy. In fact, the epilepsy could actually increase. So when we do stem cells in a child with epilepsy, we must be very careful why we are doing it. Stem cell is not, and I repeat, is not a treatment for epilepsy. Like I said, it can actually aggravate it. But the other things do improve. So, we have to balance that out. So, all the other things in CP, they show dramatic. The drooling completely stops, neck holding gets better, sitting gets better, standing, walking. Or, the majority of kids, we're able to get them off wheelchairs. They are walking. I mean, they may not be walking independently. They need some support, but they are able to get onto their feet. So,
But that's also great. I mean, just getting off the wheelchair to help themselves or be a little bit independent is great as well. Will stem cell therapy be effective for dysphagic children?
For
Children with dysphagic children.
Yeah, so again, it depends on the cause. So dysphagia is, there can be different causes of it. The causes can be in the brain, or the causes can be in the periphery, like, something that has to do with the throat and the oral cavity and the esophagus and stuff. Now, if the dysphagia is because of a neurological cause, that improves a lot. So in a lot of our children with CP who have difficulty in swallowing, their swallowing improves dramatically. However, if the problem is in the esophagus, the throat, or the tongue, mouth, then stem cell therapy does not help.
Can it improve eye contact? CP children eye contact.
I mean, eye contact, it's one of the first things to improve. I mean, within 3 months, eye contact is dramatically and significantly improved. It's one of the first things that improves, actually.
Hydrocephalus, does it improve?
No. So stem cell is not a treatment for hydrocephalus. What is hydrocephalus? Hydrocephalus is excessive fluid in the brain.
Yeah.
Right. The stem cells don't go into the fluid, and stem cells cannot reduce it. For that, you require a shunt operation. You have to put in a tube and take the tube out and put it in the abdomen. So hydrocephalus requires a neurosurgical procedure called a shunt, and you cannot use stem cells for it.
Okay. My son is 15 and high functioning autism. How much will it be beneficial if he goes through stem cell therapy, please?
Yeah. So the oldest child I've treated is 38 years old. Okay, high functioning, and he's also shown a lot of improvements. So they don't become. See, once you've crossed puberty, then the possibility of becoming completely neurotypical are not not as much, but they do show improvement in their behavior. They become more manageable. Their understanding improves. Their social behavior improves. Their understanding of what money is. They're able to actually do jobs. They're able to do something to earn a living. Do they become normal? No, that may not necessarily happen.
Yes.
Nowadays in this field, we don't use the word normal. We say children are either neurotypical or neurodiverse. So we don't use normal, abnormal. We don't consider autism to be something that's not normal, but just to make, because sometimes some parents don't know what I'm talking. So when I say neurotypical, it is what you refer to as normal. and neurodiverse is all the other kids with autism and
Yes.
CP, etc. So the improvements we've seen in older kids is that they become a little more independent. They have a life. I mean, they can look after themselves. They can do work. They can do a business. They can. So all these things which are important for independent living, they all come in. So I would say a 15-year-old kid, well, we should treat.
Will stem cell help rejuvenate brain cells, or is it mainly to help muscles and tone?
No, it helps to regenerate brain cells. We've actually got so many scans that show that the brain cells actually recover and regenerate. So it helps with muscles, but it helps tremendously with the brain. And we have literally thousands of scans, before and after, that show regeneration.
Someone wrote, but I thought brain cells cannot be reproduced or moved. Is that
Yeah,
not the case?
yeah. So what happens? Let me explain. That's a very intelligent question. What happens is that if you remember my presentation, I showed you all those blue areas. So those are brain cells that are inactive. They are sort of like dormant. They are hypometabolic. They are inactive. So when our stem cells go there, these areas, they attract the stem cells towards them. These stem cells go and repopulate that area, and then they sort of activate the dormant stem cells which are there. They do sort of wake up, reactivate,
Awaken. Yeah.
re-energize.
Awaken them.
All
Yeah.
different. And all this work we had done before. So I have been doing stem cells in adults and children since 2008. But from 1998 to 2008, 10 years, we did basic research in the laboratory with animals. So we did all this, and in animals, what happens is you can sacrifice the animal and you can see what happens to the stem cells.
Yes.
So actually, I didn't put pictures in this, but I have pictures from my basic research, which actually show how these cells,
The
once they
change.
convert to brain cells, how they activate. So, see, a cell which is dead, stem cells cannot wake up that. You cannot put life into a dead cell. Okay, so if there's a dead cell, that cannot be recovered. But if there is a cell that's living, but not functioning 100%, stem cells can activate those cells.
Okay. So that's a question me and you, doctor, when we met, we talked about. So I live in the UK, and over here they say that autism is not curable. Why is it not acceptable here? So why is this treatment not popular? Why it's not acceptable anywhere in the world?
So the thing is that stem cell therapy, see, most medical treatments, all other medical treatments, pharmaceutical, cancer, heart, cardiac, they all evolved more in the Western world. So it was America and Europe and Britain that,
Yes.
all these treatments. Stem cell therapy has developed in the East. So India, China, Japan,
China.
and Korea. These are the four countries: India, China, Japan, Korea. We are the leaders and pioneers in this. So it's something which is developed in the East. And so Western countries find it very difficult to sort of accept the fact that we are way ahead of them. We are like 15 years ahead of them. The Western world is catching up now. In America, the Duke University has started the process of using umbilical cord cells. So the America has started doing the stem cells now. They are 15 years
Yes.
behind us. And once, of course, America starts doing it, they will start following it in England as well. People from England will not follow it when it's being done in India and China, but they will start doing it when it's done in America. It's just the way
Yes.
the world is. It's not whether it's right or wrong, that's how it is. The second reason is that the entire medical world is driven by the pharma industry. The big pharma, they drive everything. They drive, like everything. I don't want to go into
Yes.
detail. And we are not the favorites of the pharma world, because when our patients get better, they stop taking drugs.
Yeah.
So the
So there's
pharma
an ethical
is
also.
pushing us. The pharma industry. I mean, and in the medical world, unless you have pharma backing, nothing. Nothing
Yeah, nothing
really.
will happen.
So there are many reasons. I could go into it back and forth. I mean, there are a whole lot of reasons that we can get into, but this is primarily, why it is not. And the reason for that goes back to what happened was that in 1998 they discovered these stem cells from the embryo.
Yes.
And they started doing embryonic stem cell work in America. Now, you all aware that in certain religions, the Western world religions, abortion, family planning is not permitted. We have this whole abortion
Yes.
thing in America right now. So they were against use of embryonic stem cells. So the President George Bush banned the federal funding of embryonic stem cells in 2001. Now, people remember that ban. What they don't remember is that when Obama became president, one of the first things he did was he lifted that ban. Okay, in
Yes,
fact, one of his election promises was to lift the ban. But the Western world and that entire part of the world is now still hasn't recovered from the ban. But this ban was for embryonic stem cells. Stem
not
cells
for,
taken
yeah,
from aborted fetus. We are not anywhere near the embryo. We are taking cells from our
the
own
child.
body, putting it
Yeah,
back into our
bone marrow.
body. So there is no comparison only, But
Yeah.
that is unfortunately what's happened.
Yes. So we'll take one last question, although there are so many. We've taken a lot of your time, doctor. So there is a difference between institutes. Some institutes administer 3 injections and others administer 1. What's the difference?
Yeah. So what some institutes do is they take the cells, they put part of it down, then they culture and grow the cells in a laboratory, and then put those back again. All right. When we did basic animal work, we found that the body is the best place to culture it. So what so instead of so let's say I have 100 cells, I put 30 right now. I take 30, I grow them in the laboratory, put it back after a few weeks, take the remaining 30 and put it back. So you take the same stem cells, but you're doing things
Yes.
in the laboratory with them.
Mm-hmm.
Now, when we did this in animals, we found that doing it outside was not as good as putting it in the body, because the body is an amazing biological machine. When you put what these people are making outside the body does itself. So we let the body do the multiplication.
Mm-hmm.
When we put inside, the body does the multiplication and division. We don't want to, because the moment you keep it outside, first, see, you understand, we take out, separate, and put it back. It doesn't lie outside at all. But the people who give it repeatedly, they add chemicals, they add growth factors, they multiply, they grow it artificially, and then those
Outside the
go
body.
back outside. So it's got a whole lot of chemicals and preservatives and a whole lot of other stuff. So we are not happy with this whole preservatives, artificial stuff. We like things natural. And, so my thing is, the difference between the two, the example I give is, what would you prefer? Take a fresh orange and give fresh orange juice to your child, or give canned orange juice, a Tropicana or something, right? Our thing is fresh orange juice is the best. It's natural,
Yes.
it's safe. Anything that is canned is preserved, and anything that is preserved can never be as healthy as something that's natural.
So, doctor, the take home message would be that stem cell can help any neurological disorder that causes um, an alteration in the brain scan. Anything else, stem cells is not the cure for, or was not going to help.
Exactly. That's very correct. Very well put.
And any last messages or any recommendations for the parents and professionals attending with us?
Yeah. So a couple of things. The first thing, I mean, apart from stem cells, we've been, in this field for a long time, and we've seen several children who are now completely off the spectrum.
Yes.
When it comes to autism, we have cerebral palsy kids who are independent, going to schools, graduating, doing jobs. A couple of things we've noticed. One, all the parents whose kids have done normal, they've had a very fierce acceptance of their child, the way the child is. They do not see their child as less than, they see the child as different. They look at what is special in the child, and they don't look at what the child does not have. So that's the first thing we have to do. Do not go by what the world says. This is our child. The Almighty gave us this child. This child has some special qualities. Maybe there's something the child cannot do. So acceptance of the child, the way the child is very important. Number one. Number two, we've seen when the whole family works together, the results are much better. The mothers by default don't have to be told. Mothers look after their kids anyway. But we've seen that when the fathers are also actively engaged, when the brothers and sisters, the siblings, when the grandparents are the children tend to do much better, because all that gives input to the brain. So, who wins a match? I mean, we've got the football matches going on right now. It's not the match, the team that has the best player doesn't win. The team that has the best team
The
wins.
team spirit, yeah.
Yeah. So family is also a team. So family is very important. The third thing that we've noticed is that the kids who've done very well, they have a structure, a fixed structure in their life. So you like everything is set. The time to wake up is set, the time to sleep is set. How much time on the mobile phone, how much time for TV. So a structured life, helps in these things. Then, of course, cell therapy plays a very, very important part, because it helps repair the brain. But after that, there has to be an aggressive rehabilitation program. You have to be in an institute where you get comprehensive rehab. Unfortunately, right, very often in rehab, there's an occupational therapist who's doing therapy somewhere and a speech therapist who's doing therapy somewhere. And we find that is not as good. The best rehabilitation should be in a facility where you get everything
MTT.
under one roof. You get
Yes.
everything under one roof, where you come and the child gets everything, because the therapists, they interact, they discuss with each other. And that work, that teamwork of the
Very true.
therapist, like you have family as a team, even the therapists have to be a team. So we
Very
strongly
true.
recommend the therapy at centers where all the therapies are available at one place. So if we can do this, if we can do the cell therapy, repair the brain, follow it up with an active rehab program at a good institute where it's got everything available. If the environment at home is kept positive and structured, uh, this is what helps the children to
The
come up.
child will improve.
Will improve, absolutely.
What's the future advances? What's the next step in stem cells?
So the way we separate the stem cells, that is advancing a lot. The equipment we use now is completely, it's like our phone. The phone we have today is so different from the phone that we used 10
Yes.
years ago. So the back end technology is evolving phenomenally, and there are many advances where within the stem cells, there are various things that the stem cells produce, which you can now maybe add to the stem cell therapy procedure. So there is a lot of very exciting work which will come into play now. But it's a evolution, like a phone. It didn't suddenly change. Every model, every year, there was a little difference, and it just kept getting better. So this thing is keeping on getting better with each passing year. What we are finding is the other integrative therapy. So, of late we've learned that use of oxygen-based therapies, hyperbaric ozone, when you combine this with the rehab, that is very, very useful. Then there are a whole lot of assistive technologies that are now coming. So we're actually working on various assistive technology tools that devices that are robotic devices that are using artificial intelligence that are going to, and we're actually working on it right now, that are going to be actually identifying what the child needs and do things with the child. And so we are working on these assistive technologies. So it'll be almost like a non-living companion, but using artificial intelligence will sense what the child needs, and that is work under progress. And the final thing that again we are working on is a digital rehab platform, where we believe that what is required is intensive rehab, focused rehab, and then you have to continue some of the therapies at home so that your therapist who you have taken from can continue some of these at home itself. So we are doing work on that. So this whole combination is going to completely shift the quality of life of our children. We have several of our children who are doing amazingly well. They're kids who could not speak are talking. Kids who could not go to school are now topping in their classes and exams. They're graduating. They're doing jobs. They're running businesses. They're doing things that we had thought
Yes.
completely impossible earlier. So this is possible. It's not science fiction. It's happening now.
Yes. All the audience are thanking you and saying it was an amazing hour. Thank you very much, doctor. Thank you. All thanks. And some of the questions are repeated. I'm sorry if we could not take them all, but we did the best that we can. And thank you very much, doctor. It's always a pleasure to hear all the information that you're giving us. And it was a great pleasure to have you with us for this hour.
The honor is mine. Thank you. Appreciate it.
Thank you, doctor. Thank you. Bye. Thank you, everyone.